The invasive study of the liver vasculature consists of injecting the hepatic veins, the hepatic arteries, and the portal system that can be opacified directly or indirectly. And we have called these three techniques hepatic panangiography. The hepatic veins can be studied by advancing the catheter into the liver through the inferior vena cava that is catheterized either from the arm or from the femoral vein. When the catheter is advanced, it is placed in the wedged position. There we record pressures that reflect the sinusoidal pressure. And in patients with cirrhosis and portal hypertension, the sinusoidal pressure is elevated and generally reflects the pressure in the portal vein. We then move the catheter to a free position, and in that way we can establish a gradient. When a gradient is high between the wedged and the free position, by definition the patient has portal hypertension, and this is usually the result of cirrhosis of the liver. After we do manometry, the catheter is re-wedged, and in that position contrast material is injected. A small amount of contrast material is slowly infused, and we get then what is called a wedged venogram. Note that the outline of this venogram shows no lobulation, and that there is a uniform infiltration of the segment where the hepatic vein was injected. This means that the liver is normal at this site. As later we will see, whenever there is cirrhosis, we can expect a regular distribution of the contrast and several filling defects. Ciliaco-mesenteric angiography is the approach to the portal system. A catheter is advanced into the splenic artery and contrast is injected at that level, or it is introduced into the superior mesenteric artery, and then in the venous phase we opacify the portal vein. This technique of ciliaco-mesenteric angiography is utilized for the relief of portal hypertension on a temporary basis. On patients who have gastrointestinal bleeding, we can use this technique to infuse a vasoconstrictor into the superior mesenteric artery. This is a selective injection of the splenic artery in a normal individual. Note the uniform distribution of vessels in the spleen. In the venous phase of the splenic artery injection, we see the complete opacification of the spleen and the opacification of the splenic vein and of the portal vein. Note that there is no flow into tributaries of the portal vein. So by definition, this patient should not have portal hypertension. Another old technique which was popular was the direct opacification of the portal system by injecting contrast into the spleen. And this was the first attempt to image the portal system. This is called splenoportography. Note the opacification of the splenic vein and of the portal vein, and note that unopacified blood reaches the portal vein and represents where the arrow is indicated the termination of the superior mesenteric vein. This was a normal study. Sonography with Doppler, computed tomography, and MR angiography have replaced diagnostic angiography in many areas of the human body. So now we can see adequately the normal and abnormal portal system by using any of these modalities. So direct angiographic examinations are performed only primarily when we treat a patient, particularly if there is an episode of bleeding, and we are going to infuse selectively a vasoconstrictor, particularly in the territory of the superior mesenteric artery. So catheter angiography has been replaced by non-invasive imaging modalities. Finally, we performed the last of the panangiographic methods, which is selective hepatic arteriography. Here a catheter is advanced into the celiac trunk, and the common hepatic artery is usually injected. Note the small size of the hepatic arteries, which contrast with the large size of the portal vein. Once again, this reflects that the hepatic artery contributes with less amount of blood to the liver. And note also the filling of the arteries that supply the gallbladder. And in the parenchymal phase of the study, we can see the outline of the gallbladder, which is supplied by the hepatic artery. The venous drainage of the gallbladder is towards the portal vein.